who yields time. Gentleman from New Jersey.
Mr. Speaker, I yield myself a minute and a half.
Gentleman is recognized.
Mr. Speaker, the person who's being helped and touched by this bill is someone I think we all know. It's a person who comes home from work and is confronted with the heartache that their son or daughter is dealing with the ravages of clinical depression. And they're worried about that, but they feel secure because they say, well, at least we're insured. At least we can take care of her. Then they find out that there's a $10,000 deductible before the insurance company will pay for the visits. Or they find out there's a $5,000 limit on how much care can be received. If their daughter had broken her knee, there'd be a $100 deductible, no limit on the care. But because she's dealing with clinical depression or a substance abuse problem or another mental illness, they're conscripted and limited. This person is the one who will be helped by the efforts of Mr. Kennedy and Mr. Ramstad. It is long overdue. It will save the system money. More importantly, it will bring justice and fairness to people like the family that I talked about in these remarks here today. I congratulate Mr. Kennedy, Mr. Ramstad on bringing together this broad coalition. I would urge both Republicans and Democrats to vote yes on this worthy legislation and reserve the balance of our time.
Gentleman reserves. Gentleman from Minnesota.
Mr. Speaker, how many speakers remain on the other side? I reserve the balance of my time.
Gentleman reserves. Gentleman from California.
Mr. Speaker, at this time I'd like to yield a minute and a half to the distinguished gentleman from New Jersey, Mr. Passerelle.
Gentleman from New Jersey is recognized for a minute and a half.
Mr. Chairman, it's time to remove the stigma and to destroy the barriers for individuals struggling with mental illness and addiction. Experienced by many of our returning brave soldiers on the front page of U.S. Today. Finally, we have a breakthrough here. Society of denial results in stigmatizing the admission of emotional problems. Far too long, we focused on the external injuries of the body. We've ignored the maladies of the mind. For too long, it seemed as if we could not treat what we could not see. But modern medicine and science is showing us that these are the real diseases with real treatments. It shows us that there is hope, Mr. Kennedy and Mr. Ramstad. Mr. Speaker, this is a civil rights issue. Parity removes the discrimination against a population that has been discriminated against and stigmatized. This is a humanitarian issue. Without parity, we allow those with illnesses to continue to suffer. In closing, I'd like to say that Paul Wellstone was a great and admirable man. He was a champion for this legislation. Today, we honor him by passing this bill. The time is right. Let's pass this today, Mr. Chairman. Thank you.
Expired. Gentleman from Minnesota.
Time.
Gentleman reserves. Gentleman from New Jersey, Mr.
This is of a colloquy to my friend from Pennsylvania, Mr. Murphy. 1 minute.
Gentleman is recognized for 1 minute.
Mr. Speaker, I rise for a colloquy with the gentleman from New Jersey, Mr. Andrews. Mr. Andrews, I rise today in favor of a health care system that works for those in need. I am proud that this legislation promotes fairness for those with mental illness. I am also proud that it will not preempt stronger state laws such as Pennsylvania Act 106, which has saved countless lives in our Commonwealth. I stand with the Republican state representative from my district, Dean G. Girolamo, a leading advocate for mental health parity and someone who has worked just as tirelessly for health care laws that are fair and just. Mr. Andrews, just to clarify, does the parity legislation leave intact Pennsylvania's Act 106 protections for those seeking treatment of substance abuse and similar protections in other states?
The gentleman will yield. That is correct. This bill will not preempt in any way the services and benefits provided to citizens of Pennsylvania Act 106 and similar legislation in other states. Some examples of the types of state laws that are not preempted by this bill include state laws that mandate minimum coverage, state laws to control access to benefits, and state laws that require or govern access to out-of-network providers.
I thank the gentleman from New Jersey, and I urge my colleagues to vote and support this bill. Thank you.
Gentleman from Minnesota. Gentleman reserves. Mr. Pallone from New Jersey.
Mr. Speaker, I yield 2 minutes to the chairman of the Energy and Commerce Committee, Mr. Dingell from Michigan.
Gentleman is recognized for 2 minutes.